social media platforms. For those that are new on this channel, I'm a Namibian trained nurse currently living and working in Germany. So on this episode, I'll be talking about things that makes my job easier in Germany. Okay, something like materials that really makes my job easier, or things that I find to be useful, or things that make sense actually. Okay, so we'll start off with hygiene things. Okay, so we have this for people that are vomiting, you know, because then you don't have to give like a, how should I put it, like a kidney bowl for somebody to vomit. You can give them this, they vomit, and then you can just tie it and throw it away, so you don't have to clean or see vomiters. Okay, and then we have, these are like underwears. Okay, it's like an underwear. It's actually good for people probably that have diarrhea, or for people going for operation. Okay, so you can give them this. Is one use only, and then you can throw it away. And you can also give them this, you know, then they can wear the underwear. I love that very much. And then we also have single-use face cloth. It's good, like maybe if somebody has diarrhea, then you can just clean them with this. Okay, you don't have to use the face cloth and towels. Okay, and then we have these ones. I don't know how I will call this, but you can use this to clean the mouth. So you can dip it in maybe a cleaning solution and then clean the mouth. Is very good. But we also have toothbrushes. They already have a toothpaste on it. So for people maybe that don't have a toothbrush, or you can use this one. And then we also have laser blades. We have them. And we have mirrors for people that are probably just in bed. They can at least look themselves in the mirror. This is very good. And then we have this. This is like oil, lavender oil. We have lavender oil, lemon, and I don't know the other. For example, maybe somebody has diarrhea and the room is stinking. We could apply some oil just so it smells nice. It kind of remove the unpleasant smell. I love this one. Okay, beloveds. And then we have this plaster for decubitus. If somebody has a decubitus, or you can see maybe the part is getting reddish, we can also use this to protect the skin so they don't develop any decubitus. And then we come to, we have shampoo as well. Yes, baby shampoo, so it's sensitive. Everybody can use this shampoo. We have this, we get it. And we have shampoo cap for the hair. Somebody maybe is bedridden and you cannot transport them to a bathroom, so we can wash their hair with this shampoo cap. And we also have, these are wipes, antimicrobial wipes for somebody maybe they have an operation and they're bedridden. We can always disinfect them with this wipes. Okay, and then what else? We have these wipes. These are to clean, for example, we can use this to disinfect like the BB cap, and then pulse oximeter. We can use these wipes. And we have these ones. These ones are to disinfect surfaces. For example, before I do a wound dressing, I can disinfect my trolley and whatnot. This is to disinfect, like I mentioned, yes, this is to disinfect surfaces. And what did I miss here? Okay, and then we have disinfection meters. I call it solutions. This one is, for example, it has alcoholic, it's antiseptic. For example, maybe you want to put up an infusion line, not infusion line, yes, a Vigo. You can use this to disinfect. This is, for example, maybe you are removing an infusion line, you can use this one to disinfect. And this is for wounds and wounds or any open cuts. You can use this one to disinfect, because this one, it doesn't have alcohol, so it doesn't burn. Okay, and then we have body lotions. We have for very dry skin, and for normal skin. We have this for our patients. And we have these ones for our hands. This is for our hands, okay, to protect our hands, because we're always disinfecting and washing our hands. We have these lotions to protect our hands. Okay, beloveds, so I think I'm done with the hygiene. Then I love this. This is powder for people that have swallowing problem. We can put this powder in their water or liquids, then they can swallow better. And then I love this thermometer, because back home we have to disinfect after every use. But this thermometer, it comes with a single cap. You put it in, and once you are done, you discard. I'm discarding here, but then you see, I can throw it out later, and then after my rounds I can disinfect the whole thing. Okay, and I love this safety box. You know, it's easy to set up, and then you put everything in there. It even has an area where you can remove insulin pens and needles and all other needles. It has all these things, which makes it easier. You don't have to touch anything. For the insulin, you put here. For other needles, you put here. I love it. And then once it's full, you just clip it together and then throw it away. Okay, and then we have these two things. This one is to remove like a liquid, let me say NaCl, and maybe this is like 50 ml and I only need maybe 20 ml. I can use this one to remove the liquid. And this one is to connect to, let me say I have powder antibiotics and I need to mix it in a liquid. I can use this one to connect, which makes it easier for me. Okay, what else, beloveds? This finished normal seller is normal seller sodium chloride, like to maybe flush infusion lines. It's already finished. You don't have to withdraw anything. And for safety, I love these needles. As you can see, I'll just open it. So I'll throw it out later. So maybe you are done injecting. You clap it like this. This is safety. Mach mal aus. Jemand kommt. Let's continue. A patient needed help. That's why I had to go. And then I also love this. This is a two-way infusion line. For example, maybe you have maybe an antibiotic and how do you call it? We call it Yono. Yono here is like the liquid that we give to most patients. We don't have Lingus lactate, we have Yono. So maybe you have an antibiotic and Yono. So you can put maybe the Yono here and then the antibiotic here. Okay? And I don't know how to call this in English, but in German it's was? Sag mal, Sonja.
Ruchventile.
Ruchventile, okay. So this one, it helps so that infusions don't mix, or for blood to come back from the, like maybe you have Vigo here. So you put this one on, so blood will not come from the vein into the liquid. So it helps kind of for infusions not to mix. Okay, and then I also love this. I'll just open it. Let's say, for example, you have the infusion, like I mentioned, Yono, and maybe the doctor wants you to give it over a period of 4 hours. Okay, so sometimes you don't need like a perfuser, something like this. Yeah, so maybe you don't need this Infusomat. Yeah, you can use this. You can see here it has numbers. Okay, so maybe if you want to, let me say you have a 500 milliliter infusion and you want to give it in 5 hours, then you can just put here 200 and then it will be administering 100 milliliter per hour. So I love this as well. So if you don't always have to use the Infusomat. I love this very much. It makes my job easy. Okay, and then what else did I miss here? Okay, and then at home I think we have to withdraw the insulin, but here we have insulin pens. Much easier. You put the needle here, insulin pen, a needle, and then you inject, and you come here. You can uncap the needle here, and then it goes in here. It's also safety, and here you can see the units. You can just press like that and administer the units. And I love this as well. This is ointment for the eyes and for the nose. For example, somebody has oxygen. You can always moisturize the nose with this ointment so it doesn't dry out. I love this. And we have Oropax. These are earplugs. Maybe because in this hospital where I work, each room has 2 patients. Maybe one is snoring, so you can give the other one earplugs so they protect themselves from the noise. I love this. And so nothing broke. And this is Vigo Flaster. I'll just open it. So this is very good because back home you have to cut, but this one already comes like that. So maybe here's my needle. You put like that to secure, and then this maybe come like that. So this is transparent, so you can still see the needle if there's blood or not blood. And there's an area. Let me just open it. So here you can write the date of when you change the flaster, and it's kind of wasserdicht of English though. So it kind of, when the patient is bathing, it can kind of protect it because it's, I think, water repellent, if I can put it like that. Okay, and what else did I miss here? This is our sharp container. Okay, this is our sharp container. It's also easy to assemble, not so much work. You put the sharps, it's already telling you what to put and not what to put in. This is, for example, for our scissors and pincettes. You can put them here, and you can write the station and whatnot, and there's the address where it goes. Okay, beloveds, what did I miss? Yeah, now I'm going to show you something that I love so much, which makes my job easier as well. So let's go. I love the blood test equipment here. So this equipment, it's connected to the lab. So you can, every patient in Germany has like a barcode. You can scan, and then the name, the birth date and whatnot will appear, and then you can do the blood sugar test. And then once you're done with your rounds, you put it back, and then all the blood results is transferred to the lab, and then doctors can see the blood results, how it's maybe changing, how it's reacting to the insulin and all that. Okay, and the good thing is that it has memory. So in case how should I put it? In case maybe you forgot, you can always go back, and then you can see, because you scanned the name of the patient is there. So maybe you forgot, you are doing the test and you forgot. You can always go back and see, okay, what time I measured, how much was the blood sugar. Yeah, that's why I love this. Yes, I love this very much. And we always put it back once we're done with our rounds. We always put it back on the station so the data can transfer to the lab. Okay, I think we know all this. mobile oxygen. We know, I don't have to explain that. Yeah, here's our mobile oxygen station. The ones that are closed are always in the plastic. The ones that are open are always here. Okay, so let's go. I'm going to show you something else. I love this as well. You know, for patients, they can pee in here. If you want to maybe do some urine test, they can pee in here and then they close it. I'll show you why I love this. So I'm going to use water just to demonstrate. So I put water. Let's pretend that's the patient's urine. Okay. So if there's no patient in here, so you as a nurse will just open here. In Germany, everything like this has a, you can print out what you want to investigate. You put it here, so when you send it to the lab, the people in the lab, they can already scan it, and then you know what I mean. So you just press it like that, finish. So you don't hurt yourself. There's nothing. It's safe. Okay, and then you can just discard it like that. Okay, very good. So yeah, what I also love is this Hemocold test to see if maybe the patient has blood in their stools. So it already comes with something like that. So if it's hard stool, the patient can put this on the toilet, caca, do their business there, and then open here, yeah, and then take some pieces, put it in here, shake, and then they can give it to us. And the good thing is the name and the date. You can put it in here, but we usually put the names, the patient's name etiquette here, and then we have the test here. Then you can do it here. Yes, and this is just hand disinfectant. We have it in every room, every corner of the hospital. We have hand disinfectant. Okay, so I discard this here. And what I love is this machine. I love this machine so much. Let me just put my gloves on. I love this machine so much because it does the dirty work for me. At home you have to clean it, you know, with your hands, not hands literally, but as I was saying, I love this machine because it does the dirty work for me. I'll just show you something. You have a patient that cannot really walk, they pee in here, in this. Okay, so you bring this, you put it in there, or maybe the patient use a bed fan. Okay, so you put the bed fan right here, and then over there, and you close it here. If it's very dirty, you press there. Oh, it's already started. You press there. If it's not so dirty, you press there. If it's just for urine, you press there. And it does the whole cleaning. Okay? And then once it's done, you can let your things to dry here. And then you're finished. Or maybe the patient has a urine catheter. You can empty the urine catheter using this, and then you can discard the urine in here, and then there's a people that come out of here. Yeah. And then you let it sit a little bit, it disinfects, and then you can just do this. Okay, and then you can use that. Just for extra clean again, then you can let it dry here. And then once you're done, you put it back there. And we also have our sterile gloves here and whatnot. And one thing again, So this is our toilet seat. Some patients are very weak. They cannot stand for long in the shower. So they can sit here, you bring them to the toilet, or they can also do their business here, pee or caca here, or they can sit on here, then you bring them to the basin and then they can wash themselves. This is our toilet chair. I love it also very much. And this is to transfer patients from one bed to another. So beloveds, I think we have come to the end of this video. Thank you so much for stopping by. If you watched until the end, I appreciate it. Please do consider subscribing, commenting, and sharing the content. Thank you so much. Bye bye.